The Unrepresented Nations and Peoples Organization, UNPO, is working with its member, the District of Columbia, and the Rodham Institute at George Washington University School of Medicine and Health Sciences to submit a complaint to the United Nations on the responsibility of the US federal government for violations of the right to health of racial and ethnic minorities in the District of Columbia. My name is Melinda McKay. I'm a public health expert on UNPO's Special Advisory Committee. I'm a DC homeowner and my family has roots in DC going back generations. In this short video, I will explain why it's time to act now and how you can be involved. Other videos will describe the basis of the complaint and why racial health disparities in DC matter to the UN. Now, this is a particularly opportune moment for UN-based advocacy in the US, with a Biden administration at pains to reassert US leadership at the UN and to highlight the US as a key partner in frayed international alliances. Just last month, the Biden administration issued an open invitation to UN human rights experts to visit the US. We believe that the US is primed to respond to a properly formulated UN approach on racial disparities in public health. UNPO has significant strong ties to the UN human rights experts and has built a strong team around which to make a complaint of health disparities based on international human rights law. What we're looking for now is partners who represent the local DC community to build the case and together submit the report to the UN. So as a partner, you can commit to as much or as little as you like. First, we want partners to review the draft of our brief and help us gather stories from those impacted by these disparities. These impact statements can be simply a few sentences that depict real scenarios for minorities in DC. A pregnant mother, someone with heart disease, a family affected by COVID. It's simple but powerful statements of situation and impact that will give real life context to this submission. Secondly, as a partner, you would list your organization on the submission. Now, I want to be clear, this is not a legal complaint. Being a signatory has no legal or contractual obligations. You don't even physically sign anything. What you provide by joining this submission is legitimacy to this claim as a representative of your local community. You are saying, yes, these issues are real. They have real and unfair consequences that are unethical and avoidable for minorities, particularly Black and African American citizens. Third, partners can participate in advocacy. You can use this submission and the resulting engagement with the UN and US government to support future advocacy efforts around the topic of health disparities and statehood for DC. I invite you to watch the other videos and to reach out to me, to Ralph Bunch, the General Secretary of UNPO, or Dr. El Bayoumi of the Rodham Institute with any questions. Our contact details are on the final screen. Thank you.